articles and four books in oncology, and has trained over 300 residents and fellows who are now occupying leadership positions around the globe. In India, he has held a position and helped Andhra Pradesh government. And in the founding, he's the chief scientific advisor. And even recently, Dr. Nori, you are again, I understand that you are also, even currently you are supporting the chief counselor for Andhra Pradesh government, if I'm not wrong, correct?
Yes, chief advisor, yes.
Yes. He has received many awards. To name the few, he's received the Padma Shri Award. He has been honored with the prestigious Tribute of Life Award by American Cancer Society, Most Distinguished Physician Award by Memorial Sloan Kettering Cancer. Then he's also received by Nargis Dutt Memorial Foundation, and the Network of Indian Profession in the US has honored with him with an Excelsior Award, and American Association of Physician, which is an API. He's considered as Most Distinguished Physician Award in 2014. I mean, he has a big list of all these awards, Dr. Nori. I can just go on and on.
You can stop at this point.
Yes, I mean, to sum it all in a...
No, it's not necessary, yes.
Dr. Nori is amazing. He's the biggest Baba's devotee, and I'm so fortunate to have him here on our India Home program. Welcome, Dr.
Thank
Nori.
you. Thank you. Thank you. How many are participating in this Zoom?
So right now we have 55 people logged in. As 55. Okay. So there will be a couple also. So, you know.
All right. Okay. And all they can all understand English?
English, yes. They can understand English. Yes.
Okay. This will be, thank you, Dr. Srinivas Rao Garu and Kavita ji. This will be a very general talk on cancer for people to understand what is cancer, what symptoms you have to look for, and how to prevent it, and how to get the best possible care if you or one of your family members are diagnosed with cancer. What happens in the body, I will start my presentation, and then there will be a lot of time for questions and answers. That way I can address some of your concerns. As what is cancer? As in the body, in every organ, including the skin, including eye, including the tongue, stomach, everywhere, there are hundreds and billions, millions and billions of cells. They are disappearing every day, and the new cells are formed in each organ. So this is a process God has given, put it into our microcomputer in the body. And as the new cells develop, some of them may not follow the regulations. So one or two crazy cells or unusual cells may leave the rest of the group and try to multiply. If they are going at 1 to 2, 2 to 3 cell, 4, 3 to 4, one or two cells will not follow that and become uncontrolled. They multiply due to many, many factors. Many factors which we did not understand before, couple of decades ago. But now we understand how exactly these normal cell becomes cancer cell. So these cancer cells multiply and become a small lump. When they are multiplying from 1 cell to 100 cells to million cells, you will not be able to see them on the X-ray. Sometimes they produce symptoms, sometimes not. To see anything on X-ray or a CT scan, it has to have certain mass. Any tumor in the breast, in the lung, in the brain, anywhere, if you are able to see that on a scan, it already has 1 billion cells. 1 centimeter tumor has 1 billion cells. So what the purpose of all these healthcare education sessions is to educate you. Don't allow it to grow. If there are symptoms, go and seek advice, medical advice from the doctor. So come back to again how the cancer cells become. The normal cells become cancer. So these cells multiply and multiply. They develop their own blood supply. They develop their own nutrients. They develop their own channels of communication. So one cell becoming billion cells, becoming a lump in the breast. In between, you will be feeling some symptoms. That's what the theme of the presentation is. Anything that in your body that you think is not usual. For example, if you have cough, it's not going away, 2 weeks, 3 weeks, 4 weeks. You went to see your primary care doctor. He put you on antibiotic, but it's still not going away. Then seek a medical advice from an oncologist, or tell your primary care doctor, doctor, can this be something else other than a routine infection? The same thing with bleeding. The bleeding can be from your female vaginal area, cervix, or bleeding from the rectum. That occasional people call that, due to hemorrhoids and all that. If it is still not going away with routine treatment, seek medical advice. Everything the same. One thing I'll tell my patients and public, cancer also has some rules and regulations. People come to me and say, doctor, I was okay until yesterday. I suddenly found this, and I have pain in the breast and all that. It won't happen. It gives you signals. Yesterday there is nothing, and today there is a lump. That's not the way cancer behaves. So what we had to do is we have to listen to and feel any symptoms that is coming evident from these developing lumps, either in the lung, in the breast, in the rectum, anywhere in the body. So first thing is, don't sit on symptoms. Seek medical advice. Very important. Why is so important? Is because if we can diagnose any cancer anywhere in the body, if we can diagnose and treat that, the cure rate can be in excess of 95%. That means basically it's completely cured. You're back to normal society. I have so many patients, hundreds and thousands, both from India and America. People go for mammography. There was no lump, everything is normal. They continuously repeat everything every year, depending on their risk, every 2 years. And a small shadow comes on mammography. Then we intervene. We remove that lump, and you can give the patient 100% life, normal life. A normal life in the sense, not 4 years, not 5 years, 50, 20, as long as God has given them full life. So this message is very important. The message is, don't sit on symptoms. If there is a symptom, seek medical advice. If there is something there, make sure that is in early stage. That means you caught it very early. The cure rate is in excess of 95%. This is very, very important. So what are some of the risk factors we had to be worried in our daily life? The risk factors are, number one, overweight. Overweight, the fat cells can cause havoc in the body. They can increase your risk of cancer in the breast, in the uterus, in colorectal area, many sites in the body. For men, in the prostate. So make sure that you maintain reasonable weight, not overweight throughout your life. And if you have little bit, you have overweight problem, make sure you put yourself on the regimen that I just watched before. a good exercise, physical activity is very critical. Physical activity is very critical. The next thing is make sure you eat the right type of foods. What are the right type of foods? Make the right type of foods are those which will not give you overweight. That is, especially for Indians, cut down on the intake of fatty foods, oily foods, very important. So anything that irritates the membrane, the cancer, the normal cell, don't allow the normal cell get irritated from all the stuff we put it into our body. So what you eat is very important. That is a reasonable diet. Most important is low fat, high fiber diet. One good thing with Indians, both here and in India itself, we eat a lot of vegetables, in the greeny vegetables, leafy vegetables, which has a lot of fiber. When you eat fiber, high fiber diet, the fat content will be lowered in the body. And if you add that to that little bit of physical activity, your chances of getting any type of cancer anywhere in the body diminishes significantly. So number one is don't eat fatty stuff. Don't eat fried food. Everything in moderation. And don't eat too spicy food. We are again fond of spices. In southern India, for anybody in the audience from South India, we eat a lot of spice. A lot of spice. The spices irritate the membrane in the stomach. And once the membrane is irritated, then the bacteria, a special type of bacteria called bacteria, can cause irritation, become an ulcer, and then become a cancer. Helicobacterium, this bacterial name. So make sure you eat less spicy food. The third thing is don't eat when the food is too hot, because it can burn. You know, you can see if if there is a burn on the skin, you can see it. If there is a burn internally in your esophagus, the food pipe, or the stomach, you will not be able to see that. It takes many, many months to heal. And we will not allow it to heal because we put something or other continuously to irritate it further and further. So make sure that you don't eat very hot foods, especially in the elderly people. The membrane becomes very thin in the stomach and the esophagus. It burns very easily. So may bring it to room temperature and try to consume that. That is, now the next thing is in South India, I'm sure in North India also, we have a tendency to use the same oil again and again to fry our foods. Every time you use the same oil and burn it and use it for cooking, the hydrocarbons, the so-called cancer-causing agents, will increase every time in the oil. So if you use it 1 or 2 times and throw it away. Don't keep it in your place and then start using every day for same oil. That's important. When the oil is burning, when you are putting the fry on the pan with oil burning, make sure that your exhaust is on. And we have, as Indians, we have a tendency not to use the exhaust because the flame will not be steady. That's wrong. Do not inhale those fumes coming out of boiling oil. Dangerous. I have seen so many patients from India and never smoke, never have any problems. You know, as you know, Indian females never smoke, but still has lung cancer, mouth cancer. What is the reason? It's not coming from the cigarette smoking. It is they are getting lung cancer because our ladies are always in the kitchen, and always the highest chance of inhaling these carbon fumes coming from the boiling oil. And in India, we have no ventilation system in the kitchens. Even here, if we have it, we have to make sure we use it. So I have seen hundreds of cases of females with lung cancer coming to see me from India. The only reason why they get that cancer is continuous inhalation of these carbon items, carbon ions from the boiling oils. I hope you are following the instructions I am giving. It's never too late. Never too late. You can implement these anytime. The third thing, or fourth or fifth thing, is we have a tendency to preserve our pickles, especially in India, in oil. So those oils coming from the preservation of pickles has two problems. One is that oil, preserved oil, can produce the same damage in your body as the cigarette smoking. So if you are in the habit of taking them, take them in moderation. And also, to preserve our pickles, we use a significant amount of salt. In these chutneys or the pickles coming from market. So those salts are also dangerous. Not only they can produce cancer, but also if you have a problem with high blood pressure, you tell the doctor, I don't take too much salt. I just, my diet is very soft, very completely vegetarian. We don't use any salt, too much salt in the food. But the problem is, you take pickles. Each pickle, each time when you take, you are almost taking half spoon of salt, which is not good. So these are some of the simple tricks that you can keep cancer away. And make sure you also have good vitamins, multivitamin, especially when you are in a senior group. Make sure you take at least one multivitamin a day, because you have to maintain certain level of immunity and strength in the body, that the cells are vital. The vitality of the cells is maintained by giving them all the necessary micronutrients through these multivitamins, eating fresh vegetables, fresh fruits. We have plenty in America, but we never, when you may go to shopping, to grocery, to Patel Brother or Maharaja, you rarely take these fruits. There are so many fruits on the table there. Buy them. Oranges, apples, all kinds of fruits are there. Strawberries. They have significant amount of micronutrients that when your immunological status of the body is getting disturbed because of various stresses that we go through, these things help. So we discussed about, luckily we don't consume too much alcohol. That is another significant bad factor. But anything in moderation is okay, even if you are in the habit of taking alcohol. So overweight, eating important foods, no greasy, no fatty foods. High fiber is important. Keeping the exhaust on when you are cooking is important. Don't fry oil number of times. Use it every day for 1 month, 2 months. It's dangerous. And pickles, be careful when you use in moderation. And salt also in the pickles can give you a lot of troubles. So these are some of the things you can do. And the symptoms I told you, if you have persistent symptoms, seek medical advice. Very important. I have cured so many individuals when they came to see me in early stage. We can cure them and give them full God-given life. I have patients whom I treated from all over the world. They come for checkups, not 5 years, not 10 years, not 20 years. I have patients coming for last 45 years, regularly, once a year or once every 2 years. These things, the cancer is no longer a death sentence. Important to remember, because not only we know how to prevent, but we know how to treat also. The treatment advances are also incredible in oncology. And I will tell you some of the treatment advances in simple terms. I will not use technical terms. In the past, if a lady has a lump in the breast, we used to take out the breast, mastectomy. That is no longer recommended. What is the current treatment now is remove the lump and give 1, 2, 3 weeks of radiation, depending on the size of the lump. You are cured for life. You don't have to lose the breast anymore. The stigma in the past was, if you unfortunately are diagnosed with breast cancer, the females fear that they had to lose their breast. That fear is no longer there. You can have regular checkups, and regular checkups, if our recommendation, American Cancer Society, is anybody after 45 or 50 years should have a baseline mammogram. If you have a family history of cancer, breast cancer, mother, aunties from your father's side have breast cancer, your checkup should start at age 45, not 50. This routine mammogram can save your life. And routine checkups, when you go to see men who are listening to my talk, go for checkups and ask them to do simple tests. PSA, blood test, can tell you if you have prostate cancer. If you have early prostate cancer, we can cure it without any doubt. But if you sit on it and give chance to the cancer to spread to other organs, it becomes difficult for doctors to cure it. So always early detection, early treatment is the key to complete cure of cancer. And I can go on and on about what advances have occurred in cancer. But I'll just tell you a few things, and then we will allow questions and questions from the audience. In the past, I told you 3 decades, 4 decades ago, we didn't know too much about how a normal cell becomes a cancer cell. I will give you a little example. Each cell in the body has a central nucleus, like a central mass, small mass. And then around it is a membrane. Take example of a bicycle wheel. It has a peripheral wheel, the spikes, and a central hub. The central hub is the nucleus, the DNA. That's where the multiplication of the cells occur. We didn't know much how the normal cell is getting stimulated, irritated to become cancer cell until few decades ago. We thought the central nucleus by itself is getting some messages to become cancer cell. But we now know that the signal for that central hub is coming from the peripheral membrane, which is the wheel, from the periphery of the wheel. It is sending a signal like this through the spikes to the center of the nucleus, multiply, get into multiplication, develop another signal is telling the central hub, develop your own blood supply. The other signal from the periphery of the cell telling, go metastasize, spread it, spread to lung, spread to brain, spread to liver. So each signal is responsible for one bad behavior of the cancer cell, the nucleus, the central hub. So what we found out in the last 1.5, 2 decades of research is how to find medicines to block these signals coming from the periphery of the cell, central nucleus. So we have found medicines. For each signal, we have one medicine. I will give you one example. The tyrosine kinase inhibitor. There is one called tyrosine kinase inhibitor. That signal blocks the nucleus from multiplying, from the cell central hub from multiplying. So that's simple. So we found a pill for that called Gleevec, a chronic myelogenous leukemia, where people used to die before, now has over 90% cure rate with simple medicine that we discovered, which is a pill, daily pill, take by mouth. It's completely cured. How is it cured? Because we block this. This pill will block that signal coming from the membrane to the central hub. Don't do this. So various signals we found out. For many, many cancers, breast cancer, there is a signal for the cells to develop, to metastasize, to go everywhere. And by using that, what is called Herceptin, a new medication, or if this comes in injection, you can improve the cure rate of breast cancer patients by over 50%. So there are signals found for most of the cancers, but each medication works on one signal only. So if, for common sense, if each medication we developed works for one signal and one cancer, one type, if a particular cancer is the result of multiple signals, how do we attack that? Then we introduced in the last 10 years immunotherapy. Immunotherapy is like enhancing your immunological status of the body. What the cancer does, as it develops in the body, it will knock down your immunological guard, what is called the central command and control system of the body, the immunity. So the first thing it does is it knocks down your immunity, cancer cell. So these new drugs will prevent the cancer cell from doing that and maintain your immunity in the body. So immunotherapy is a game changer. In the last 10 years or even 15 years, we started using immunotherapy, which is helping and curing many, many patients, even with advanced cancer. Even with advanced cancer. I'll give you one example of Jimmy Carter, you know, our ex-president of the US. He developed cancer. It spread to brain, it spread to lungs, it spread to liver, it spread to bones. Widespread metastatic disease in the body. And we treated him with immunotherapy. That was the beginning stages about 10 years ago, immunotherapy. He is still alive today without evidence of any cancer because of this immunotherapy. Will this happen in every individual? Probably not, but we will select some biomarkers are there, which tells us whether this patient will have benefited by immunotherapy. So there are a lot of advances, target therapies, immunotherapy, designer therapies, each one. We cannot treat 100 cancer patients with the same type of treatment. Each one has to be treated with an individually designed target therapies because each one has a different molecular profile of cancer when it develops in the body. So the footprints of cancer in each one is different. Also, when cancer develops, the primary site of the cancer may have a different molecular fingerprinting than the metastatic disease it's producing in the lung or brain. So a lot of advances are happening. I will not go into details, but the good news is they are helping our patients. The good news is they are helping our patients not only here, but in India also immunotherapy is available in most of the centers, but still comes to the same basic understanding. It all depends on you as individual. First thing is to maintain good weight, good habits, and then make sure that anything that is unusual, you report to the physician immediately because the chances of cure are in excess of 90%. Thank you, and we'll wait for questions if anybody has any questions.
Dr. Nori, this is wonderful. Kishan. Thank you very much visiting our India Home platform and coming to over here, explaining with the educational advice and guidance in our comfort of our home. Thank you very much again, and we wish you long life. And I know a lot of my doctor friends and my family also doctors, they are healthy and they give a lot of their own time and sacrifice.
Right.
And I know you are also busy doctor, a busy man, taking the time out for all of us. We thank you very much. And I think God look after you and all the doctors. I hardly see any doctors getting sick or getting injured. And I think doctor gives you all long life and healthy life so that all doctor, you can look after us and all public.
Thank you.
So making long story short, I have a three-part question which you touch on, and if you can answer me in nutshell, in short, otherwise I can ask always my PCP. The first is the overweight. What would you call a common man or woman being overweight? And second one is you touch on PSA and colonoscopy. So would you suggest PSA over the colonoscopy or colonoscopy over PSA or both? Which one would be the better?
Okay, first question is what is overweight? There are, you can check on your Google based on your height, how much weight you are expected to have. So if you're a little bit over 10 pounds, 5 pounds is okay. If you have a massive difference, you try to work on a program to lose weight. Very important because overweight can cause a lot of problems in the body, especially for cancer. And the second one is the PSA. PSA is for prostate cancer. And colonoscopy is for colon and rectal cancer. Both are different. The recommendation is PSA. If you are going to a primary care doctor for a checkup, At least if you are completely normal, get annual PSA. It's a
Okay.
simple, it will be included in your blood test. The doctor has to write it only. You don't have a separate blood sample for that.
Okay.
It's easy to do, easy to do. And the colonoscopy, anybody over 50, according to recommendations, you should have colonoscopy once, at least. If your colonoscopy is negative, you don't have to worry for next 10 years.
Okay.
Next 10 years. Thank you.
Thank you very much. Thank you, doctor.
Okay, sir.
I have a question, doctor. You gave us really very deep information and I loved it. And so many things I didn't know. My next question is, one of my friend, she is in very good health, but she is so scared to go for colonoscopy and she is refusing it to go for it. Is there anything like virtual or non-invasive thing which can be done for her?
Yeah, there is a CT scan virtual colonoscopy that can be done if she's scared of any tubes or and all that. It is close to reliable test, virtual colonoscopy. No problem with that. At least that will help to see if there are any masses developing in the body, in her colon. The answer is yes.
Okay, thank you very much.
Thank you, doctor. Thank you for your very precious talk. So I have a question. Is there any test, maybe in the blood test, we saw to find out if there is cancer in our body? Any particular test which indicates the overall, condition of her body, if there is any cancer?
Yes. There are blood tests available for certain cancers, for not all cancers. For example, PSA is for prostate cancer. PSA. And the recommendations, American Cancer Society and the National Cancer Institute will not recommend routine testing for ovary cancer, for others. For routine checkups are important. That will be as good as doing blood tests. For example, cervical cancer. They go for, ladies should go for a pap smear at least once when they cross the age 50. At least once. So one is negative, then they can sit on not going there for 5-10 years without any problem. So one single blood test to dictate all the cancers is not there yet.
Thank you, sir. Thank you so much for your value.
Doctor, PSA or BSA test? B for boy, P for
P like Peter.
Okay, thank you. Thank you.
Is there anyone else? Please unmute yourself.
So we ladies should do every year mammography. That's your good advice to all of us, correct?
After 50 years, if you have a strong family history.
Okay.
Yes.
Okay. Okay.
Strong
Thank you.
family
Thank you.
history is your mother has breast cancer, your aunts have breast cancer, sisters have breast cancer.
No other
And
kind, like.
No, you should also keep checking when you are taking a shower. It's easy, simple exam. Palpate the breast. If you see anything abnormal, seek advice. I'm telling everyone because in India, now breast cancer has overtaken other cancers in females. It's the #1 killer in India.
Yes.
What is also alarming in India, I'm going to India 2 days. I give lectures and see patients there. What is alarming in India, in females, is the breast cancer incidence is moving to younger and younger patients. In the past, We used to see breast cancer after 60, after 65 years. Now I see breast cancers in India at age 30, 35. So what we recommend here as recommendations have to be modified in India. The mammography and all this should start at age 35 or 40. It's totally different.
Thank you.
Okay, anyone else? Please unmute yourself.
Thank you, doctor.
Thank you.
Yes. I don't see any questions coming in. Dr.
Yeah.
Srinivas Raoji, like you want?
Geeta, can I
Yes.
ask one question? Geeta?
Yes,
Geeta-ji?
please, Auntie ji.
Yeah.
Yes, go ahead.
And thanks, doctor, for your all informations. Just the question was that, like, till what age you are supposed to have a colonoscopy?
After what age? After 50?
No, like at the sometimes doctor says after 75 you don't need the colonoscopy.
No, first thing is our recommendation from Cancer Society. Get a colonoscopy done when you are 50 or above 50. And then if it is
Yes.
negative, you don't have to worry for next 10, 15 years. As I told you, cancer won't develop overnight.
But is it true that after 75 you don't need to do that colonoscopy or no?
You don't have to do, because if you don't have symptoms of any
But
kind,
if you are survivor, if you have survivor, cancer survivor.
if you have a cancer survival, they do it for follow-up.
To do the
Cancer
follow-up.
survival from colon cancer?
No. Breast-
Oh,
breast
other
cancer.
cancer. Other cancers, no problem. You don't need.
So you suggest that after 75 it's okay if you don't do it, right?
Yes, yes. You don't
Colonoscopy.
have to do it. But keep watching the symptoms. If you have a bleeding from rectum or any mild symptoms, chronic constipation, don't ignore it.
All right. Thank you so much for your information.
Thank you.
Thank you so much, doctor.
Even breast cancer also, you don't need to do mammogram after 75.
Which one?
After 75 years, you don't need to do mammogram.
You don't
Is it-
need to do mammogram. That's not really true, because if you are palpating and you don't have to do it at a frequent interval at that age, like you do when you are 55. If at that point you can stretch the mammogram years, 3 to even 5 years, if the previous mammogram is normal.
Dr. Nori, do you have any YouTube, demonstration so that we can watch it again and again?
I give presentations, just Google, put my name in YouTube. I give presentations in India to media about immunotherapy, about advances in cancer, about cancer itself. So I don't have access. You can find out, put my name in the Google.
Okay,
Okay.
I
Doctor,
have.
I have a question regarding colonoscopy. Those who are scared to go for colonoscopy test, I saw in the pharmacy colon disease test, self-test for easy early warning signs.
Yes, that is the kit available in pharmacies. Colon guard and all that you see on the commercials, TV commercials. They are useful. That is, if there is any blood in the stool, they will detect it. They will detect it.
So I saw in the pharmacy.
This is useful to detect any cancer is already there.
Oh, so but it is not like doing, but yeah. Yes, sir.
We want to diagnose cancer when it is small through colonoscopy.
Mm-hmm.
So colonoscopy
Okay.
is important. And first thing they do is they will ask you to do this colon guard test to see if it shows any blood in the stool. If there is blood in the stool, you had to go for invariably to colonoscopy. No question about that.
So this easy detect pad will help us to find out if there is blood
Yes,
in the
yes,
stool.
yes, yes.
Okay, thank you, sir. Thank you so much again.
Dr. Nori, this is a question again. I have one question. We have always argument between me and my wife, as always, usually all over the places, about the colonoscopy. So we discuss, they say men, they need a colonoscopy, but woman does not need require a colonoscopy. Is it true?
That's not true.
Okay.
That's not true.
So the time period is the same for men as well as women.
Same. Actually, my wife, who is also a doctor, she went for colonoscopy the second time in 5 years. Completely normal, though. These are all little cumbersome, people think that they are intrusive in our life. They are not. They can save your life. They can save your life.
Yeah, thank you. Thank you.
Kishan Uncle ji, you won this battle.
Yes.
Okay. And Harvansh Kumari Auntie ji, please.
Yeah, I had the same question about 75 and over. Do I need to have the colonoscopy? I have never done that before.
If you have not done that before, please go for it.
Yeah. Okay.
And if you are afraid of colonoscopy, do at least a virtual colonoscopy with the CT scan.
Okay. Thank you.
Yes,
Thank you,
Balaji.
sir.
Balaji, you can go next.
Dr. Nori, I have a question. My PCP says that if you're over 75, you don't need to take a PSA, because even if you have prostate cancer, it's a very, very slow process. Probably you will outlive the cancer growth. Is that correct, or
that's not correct? I have patients who are 90 years I treated. 90 years. The cancer was found because of PSA.
Okay, thank you.
The problem, yes.
Okay, I have a question. That's how they go. Sometimes doctor want to do the mammography every 6 monthly. What they see, and the person living a normal life, they have no complaint, nothing. So what they find in that they want to see every 6 monthly or yearly the breast mammography.
Every 6 months is too much. Unless you have cancer before, breast cancer, we do follow up every 6 months. Now, if you don't have any cancer problem, 6 months, nobody recommends every 6 months. Unless they see something, some microcalcification, some findings which they are not sure what they are. So they may ask you to come back every 6 months until we know what it is.
Okay, because every year I know they want to do it every yearly. Okay. So it means they have something they see, that's why they want to come again and again.
Yeah.
Because
they're uncomfortable with the finding. They're not sure how to report. So they will ask you to come back every 6 months because you have either fatty breasts or some calcifications which they don't know how to characterize them.
Okay, thank you. Thank you. Very nice program and very knowledgeable. So thank you.
I have one more question, doctor. Sometimes I have a diarrhea problem, maybe 2-3 months, not every time. And then when I bathroom, I do 9-10 times, and then the blood comes out in the stool or when I wipe it. So I have done colonoscopy maybe like 6-7 years ago, was negative. Would you advise something? And for the blood thing, something from urine also, I did all the cancer tests, everything. So everything was negative with the blood test and biopsy. Would you suggest I should go for colonoscopy also? when I have a stool problem or just like that?
I think, you may have colitis, may not have cancer, but colitis. Still, they had to diagnose, you had to go for it. Because some of these polyps, some of these colitis conditions may be hiding the cancer behind.
So what do you have to do? Like, how do you get colitis, or what is the main reason? If I have colitis, how do we know?
Yeah, you have to, the gastroenterologist will guide you on that, to put you on high fiber diet and all. There are special dietary modifications for that.
Okay, thank you, thank you.
Dr. Nori, this is wonderful. And initially you said that this is nutrition, what is there, but everybody is really, really excited.
Thank you.
Thank you. And I have a question as an individual. We have a wheat variety with 10 times more fiber, 32%. And I would like to know how this can be used in various conditions, not only cancer, from your experience as a physician for better health of people.
Yeah, I think you are the expert in that, molecular nutritional programs. Or high fiber is always very important for body. Very important for body, not only to prevent cancer, to prevent other medical conditions, to control diabetes, to control hypertension. High fiber is very critical. In whatever form you can produce, you can add to your diet.
Thank you. And to all the members, we have been doing these presentations by experts from different fields for a number of months. But not only we are doing only presentations, actually we have that 10 times more fiber for making rotis with us. And soon we'll talk about products, what to eat actually, which are better. I'll come back to you with those details later. Namaste.
Namaste. Thank you, everyone.
Thank you, Dr. Srinivas and Dr. Nori. Thank you for your precious time that you spent with us.
Thank you so much, doctor. Thank you.
Come back again, sir. Thank you.